And welcome back to This and That, as we are now joined by Dr. Chip Harris from Erlanger to talk about managing diabetes during the holiday season. And we're human. There's going to be turkey, casserole. I mean, there's going to be all these options that are out there, and we're going to indulge, of course. But first, there is some rules, I guess, when it comes to those that do have diabetes, and moderation is probably one of the biggest rules.
Exactly. I never tell my patients, don't eat anything that's sweet, don't eat anything that has calories or carbohydrates in it. It's all about moderation and portion size control. You can have a piece of pumpkin pie, just don't eat the whole pumpkin pie. Sure.
That's probably one of the easiest things to think of and keep in mind, but are there other ways to sort of navigate through the holiday season with diabetes?
Sure. Number one, the main thing for most diabetics is knowing what your blood sugars are and making sure that you have a routine for checking your blood sugars, seeing what you're doing, and knowing how meals affect how much the blood sugars rise.
Now, there are some new options that are out there, as we were talking just moments ago, that sometimes if you're diagnosed with diabetes, you have to start giving yourself shots. That's not always the case.
40 years ago, we didn't have a lot of medication options to take by mouth, so now we have about 5 or 6 different classes of medicines that are given in pill form that do a great job of controlling blood sugars, and particularly long-term, 4, 5, 10, 15 years worth of blood sugar control. And a lot of times that eliminates the need for patients to progress to insulin shots down the line.
Now, does all cases need insulin?
No, some do, and it depends on how long somebody's had diabetes, how well they are controlled, what their medication regimen has been to that point, and a lot of times compliance with diet and medications plays a big factor in that.
Now, what should our blood sugar levels be?
For most people who don't have diabetes, the general accepted number is going to be less than 100 when you're fasting. And then after meals, about 2 hours after a meal, it should be definitely less than 140. Now, for patients who have diabetes who are under treatment, we typically slide those numbers up a little bit. About 120 fasting to 160 after meals is kind of where most doctors try to shoot for. But again, it's all individualized. And that's the key, is talking to your doctor, making sure that you're on a good program that is individualized and personalized for you, so that you're going to get the best results long term.
I'm going to call out the guys out here because I know we're stubborn. I'm going to count myself in as one of those guys that's stubborn as well. When is it that I need to start being concerned? Let's face it, I'm no thin chicken here. Is there signs? Is there times when I need to come in and start talk with you to be worried? What can we do?
Well, there's a long answer and the short answer. The short answer is now. We try to get everybody to come in at least once every year or every 2 years for a preventative checkup, and checking for diabetes should be part of that checkup. For patients who are at higher risk, either if they're overweight, if they have heart disease, have high blood pressure, then we check those patients a little bit more frequently. But most pediatricians now check kids to screen for diabetes early because we're seeing so much more of that.
Now, do genetics play a major role in this, or can this just really impact anyone?
Sure, absolutely. Genetics are a huge part of that. It's not the whole story. Certainly lifestyle factors, diet, exercise amounts has a lot to do with it. But for type 2 diabetes, which is the vast majority of what we see, genetics is a significant factor. If there's a strong family history of that, then yeah, you're at higher risk and we should check you more frequently.
And those that might indulge a little bit too much, you know, yes, we're supposed to do it in moderation, but we pig out one day. What are the impacts of that? Is that something to really be concerned about? You know, what are those impacts, I guess?
If you occasionally go off the reservation, not a big deal. Not a big problem. It's what we look at in general. People who eat too much, a little too much every day, you pack on a pound here, a pound there, 10 years down the line, there could be a problem.
All right, well, we appreciate you coming in and talking with us about managing diabetes through the holiday season. For more information, you can always contact the fine folks there at Erlanger South Family Medicine. That's located at 60 Erlanger South at Suite A. That's in Ringgold, Georgia. The phone number is 423-778-2900. Doctor, we appreciate you coming in.
Thank you.
Thanks a lot. Folks, after a short break, we're going to introduce you to this week's Wednesday's Child.